Deepika to work further.
Ma'am, you are live.
So welcome everyone to this webinar today. And this is a webinar with a difference from the AIOS headquarters. We are going to be talking about how to obtain patents in ophthalmology. This is something which is, I think, very close to everybody's heart, although we know how to do research in ophthalmology and how to publish, how to present, but we really don't know how to own it up as our own, how to put IPR on it and how to own it up and put it as our own, and also how to then commercialize it. So we have great speakers today who are going to help us in learning this. And we have our chairman, Dr. Barun Naik sir, who's the president of All India Ophthalmological Society, head of the Department of Ophthalmology, PD Hinduja Hospital, Mumbai, Professor Mahipal Sachdev, immediate past president, chairman and medical director, Center for Sight Group of Hospitals, and a great proponent of intellectual property protection and the fact that we should have it. Dr. Lalit Verma, who's the president-elect of AIOS, director, Retina Services, Center for Sight, New Delhi, and Dr. Rohit Shetty, vice chairman, Narayan Netralaya, Bangalore. I have with me my co-moderator, Dr. Rajesh Sinha, who's also the honorary treasurer of AIOS and is professor at Cornea, Cataract and Refractive Surgery Services at RP Center, AIMS. It is my pleasure to introduce our speakers today who are from a different field other than ophthalmology, although they are linked to ophthalmology. Dr. Thirumurthy Velpandian, who's a professor of pharmacology and in charge of the Ocular Pharmacology and Pharmacy Division at RP Center, AIMS, New Delhi. He completed his graduation in the Pharmaceutical Sciences from Tamil Nadu, Dr. NGR Medical University with distinction in pharmacology, pursued his PG in drug assay and pharmacology, and subsequently pursued PhD from AIMS in 1999. And it is at that time that I actually met him, and I've known him since then. And I'm a witness to all his achievements and accolades that he received and all the hard work. He's 24/7 in ocular pharmacology lab at RP Center. He was awarded PhD in collaboration with this institute, which I cannot pronounce, but is in Germany. He's working on ocular pharmacokinetics with special reference to contribution of xenobiotic transporters in blood ocular barriers involved in developing animal models, drugs, their formulations, delivery systems for ocular angiogenesis, infection, cataract, and dry eye. His lab is involved in studying ocular toxicity, drugs, tear, lipidomics, pharmacogenomics, and ocular QS-PR studies using molecular dynamics. He's funded by extramural projects from DST, DBT, ICMR, Ministry of Health and Family Welfare, DRDO, AIMS, pharmaceutical companies in India, and agencies from abroad. His lab has received level 1 grant under DST FIST program for high precision bioanalytical facility with tandem mass spectroscopy. And he's participated in several of these scientific sessions in different capacities, not only in India, but also abroad, and also as technical expert and academic committee member in various biological and pharmaceutical organizations. He is advisor and member in various committees of Government of India for making decisions in drug and research related affairs from time to time. In AIMS, he is in charge of the IPR and Technology Transfer Division. He's also in charge of AIMS Innovations Facilitation Division. He's received big BEREC for scaling one of our own innovation and in fact partner in crime, and that is on Netasol and Netamatrix, which is going to be commercialized very soon. And in total, he has 9 patents filed, 4 which have been granted, 1 US patent and 1 Chinese patent, and over 135 publications to his credit. I would request Dr. Rajesh Sinha to introduce the next speaker. Dr. Rajesh is there. I think he's not joined. I would again take the pleasure in introducing the next speaker, Dr. Chitra Arvind, who's partner LEX IP Care Intellectual Property Attorneys. She's done MS degree in pharmacy with specialization in natural products from NIPR Chandigarh, doctorate in field of natural products in 2005, and she's a gold medalist, MBA degree in marketing from IGNOU, and postgraduate diploma in intellectual property rights from National Law School, University, India. She has wide experience in techno-commercial and techno-legal background and research articles and patents to her credit, and experience in handling the patent filing, prosecution, and oppositions. She gives strategic advice on crafting and developing patent portfolios, providing patentability and freedom to operate opinions, advice on regulatory laws, drafting and filing of patent applications and oppositions in India and abroad as well. And she's instrumental in obtaining first compulsory license granted in India for the drug Sofrafinib, and has also assisted in several ongoing litigations of pharmaceutical compounds in High Court and Supreme Court of Delhi, as well as other high courts across India. She's drafted and filed more than 250 oppositions in Indian Patent Office and other jurisdictions in national and international forum, and mentored and trained people for projects in management and intellectual property rights and regulatory, and delivers seminars and lectures in several forums. She's also the visiting professor at several academic institutes and conducts workshops across India. We have Dr. Bansuri Velpandian with us, legal consultant at BIRAC, New Delhi. And she's graduated from AIMS New Delhi, studied law from University of Delhi, postgraduated in law, specializing in contracts, including mercantile law and consumer justice, and was conferred doctorate in law in 2012. She's practicing advocate in courts of Delhi since 2001 and specialist consultant for policies at ICMR under DHR. Member of Internal Complaints Committee of Goods and Services Tax Network and Biotechnology Industry Research Assistance Council. She's a senior legal consultant for BIRAC of DBT and of DST, and one of the panelists in the International Center for Alternate Dispute Resolution under the Ministry of Law as mediator, fellow of Chartered Institutes of Arbitrators UK, member of Association of University Technology Managers USA, life member of Indian Council of Arbitration, completed directed studies in private international law of Hague Academy at Peace Palace. Also the legal expert member in Institutional Ethics Committee for Research using Human Subjects at AIMS, Sir Gangaram Hospital, National Institute of Immunology, and National Brain Research Center. And she's a trainer resource person in areas of her academic specialization and passion, including human rights, health law, contracts, technology management, policy making, bioethics, alternate dispute resolution, and comparative jurisprudence. So thank you, Dr. Bansuri, for joining us today. We have our expert panel, Dr. Partha Pishwas, Chairman, Scientific Committee and Director, BBI Foundation, Kolkata, Dr. Chitra Ramamurthy, Chairman, ARC and Medical Director, I Foundation Group of Hospitals, Coimbatore. We are fortunate to have Dr. Mukesh Dholakia, who's joined with us today from Dholakia Eye Hospital, Mahua, Bhavnagar, Gujarat. Dr. Suven Bhattacharjee, Consultant, Nayan Eye Center, Kolkata. Dr. Subina Narang, Professor of Ophthalmology, Government Medical College and Hospital, Sector 32, Chandigarh, India. Dr. Taru Devan, Professor of Ophthalmology, RML Hospital, Delhi. Professor Deepika Singhal from Ahmedabad, Professor and Head of Ophthalmology, GMERS, Sola. Dr. Pukhraj Rishi, Senior Consultant at Shankar Nethralaya, Chennai, India, and now he has relocated abroad. Dr. Abhijit Kake, owner and consultant, Dr. Kake Eye Clinic from Pune. Dr. Parikumar, the Light Eye Hospital, 39D Bypass Road from Dharampuri. Dr. Gaurav Gupta from PGI Chandigarh. So I think we would now begin this webinar on patents and ophthalmology. Very difficult to introduce lawyers and ethics people. I never realized it's going to be so difficult, but we are really fortunate to have you all here. And in the beginning, I would request our President, Dr. Barun Naik, sir, to say a few words on this webinar on this subject.
Thank you, Dr. Namrata Sharma. And for this is really something, the webinar, which is with a difference. And I think you, Namrata, also knows very well that I prefer these kind of webinars, which is something where we are getting to know something new and something which is always we wanted to know. I'm not going to stand in between the speakers, learned speakers, and I'm also eagerly waiting to listen to these speakers, learned speakers, as others are also. Thank you.
Thank you so much, sir. I would now request our immediate past president, Dr. Mahipal Sachdev, to say before we commence the first talk.
Thank you very much, Namrata. And I would say again, echo what Dr. Nayak has said, that this is something very important, which the medical fraternity and All India Ophthalmological Society, the members have been lacking. So intellectual property rights, I would say, is something that is meant for protecting one's ideas, products, innovative work, etc. And it's just not the work or the ideas that we are looking at as regards the intellectual property right. You also can have the copyright, like we have had some complaints of people having plagiarized academic research papers, etc. So that is also part of it. Then you have like movies, etc., whatever, they also come under that. I would also say that even trademarks, the lawyers can bear it out. That also comes under patent. So your logo, your sign, because I've had people writing Center for Eyesight instead of Center for Sight, and our tagline, every eye deserves the best because your eye deserves the best, or something like that. So basically, all of these are protectionist things that you have. But apart from that, I would even say one of the biggest is also to protect your trade secrets, like Coke. Nobody knows today as to Coke has been there for so long, and nobody knows as to what the formula is. So that again is a protection that the IPR gives. But above all, I would say that this is to kind of encourage, and that is what AIO should do, for people to actually make what they think, their thought and their things as theirs, as their property right, and ultimately be successful in commercializing it, so that they can richly deserve the financial benefits that is there. Unfortunately, in India, if you look at medical science, I don't know, these people will bear me out more, but the number of patents that are filed per year and in ophthalmology may be very limited. But after the Patent Acts got implemented in India, I think in the 70s, there are today about 53,000 patents per year that are filed, and majority of them come from IIT. And that is why you are seeing, whenever you have a news coming, a unicorn is built today or this, etc. If you trace back, most of them are from IIT. So that is something we have to really, really put into our people, that this is where you have to be very rock solid and know about patents and know about the intellectual property rights, because ultimately these are all monetizable, and it's the idea which needs to be made commercial. So I think as was said earlier, keen to listen to what the specialists have to say, and I hope that the members learn, because we have so many innovative minds. We have seen several sessions, people coming out with great ideas, and I don't know how many of them are protecting their rights, but that is what we have to do. And we need to provide a platform in AIOS to give help to all those people who have brilliant ideas, for them to protect their intellectual property rights. Thank you very much for having this webinar, and we hope to look forward to great talks and great panel discussion. Thank you.
So, Dr. Rohit Shetty has also joined us. Thank you, Rohit, for joining. Would you want to say a few words before we start?
Thank you, ma'am. Thank you for making this program. Agree completely with Mahipal sir. Only one point I want to add before we start the program is, if you have which can be patented, please don't present, publish in any meetings or any forum which is open. This is one of the major flaws we do, is we publish in conferences, we present as free paper, it comes into public domain, or we make a video and put it on YouTube. If it's on a public domain, you cannot claim patent at all on that. So that's the only thing, and I'm sure we'll learn a lot from this meeting. But a lot of youngsters do this mistake, and when they actually go to patent, they ask the first question, have you presented, published it? They say, I presented in ASCRS, I won an award. That's over. You cannot patent it once you are, once you're not. So if you don't patent it and then present it, it's going to be a challenge. It's something which we are not aware of. Thank you, ma'am. Thank you for this opportunity again.
Thank you, Rohit. I think we'll move to the first talk by Dr. Vel Pandian, Research to Innovation, a Translation of Opportunity.
Thank you very much, Professor Namrata, for kind introduction. And I'm proud to say that, yes, I really enjoyed working with you. I think we do many things, many innovative things we work upon. And I know that many of them are in pipeline. I must appreciate your extended help in most of our approaches. And I'm very happy to give this lecture too. So I'm just keeping my lecture very, very different, and I'm not just getting into the hardcore patenting. And there, Dr. Chitra, Dr. Bhanushri, they would be talking about other aspects of it. I wanted to keep it very light. The students who come talk to me from IPR division of Yings, I always feel that they are lagging few things, especially how to figure out an innovation. So what is something we call as science? And as Dr. Rohit Shetty rightly said, they just go and publish, or just go and present it at a conference, come with an award, very happy about it, or publish a paper. I mean, that's why we settle with that. But how do we translate it into an opportunity? I mean, as exactly Dr. Mahipal Sachdeva really said that, he touched the real point of it. And many a times that we lost some good innovations just because we went and put the knowledge outside. So always that the innovation, the way we look at innovation is that it's just like there is an unmet need, and we are trying to meet the unmet need by a way through which it can brought into public use. I just want to keep it as simple as possible. Something as small as the flutter of a butterfly's wing can ultimately cause a typhoon halfway around the world. This is what a popular chaos theory is all about. And of course, ripple effect are also same. See, for a long time, we always thought that chaos theory is always a chaos. We never bothered that there could be a science behind it. But today, with the help of cybernetics, network theories, and AI-based algorithms, associations or neural networks, now it's possible for us to understand about this effect. And a ripple effect, definitely, it's creating. But how much it is contributing towards a bigger waves, now a small change in one state of a deterministic nonlinear system can result in a larger difference in the later state. This is what about chaos theory, but now we understand and we try to optimize. For example, some time back, there was a popular question that can a dancing peacock can bring rain? This is something that people always just bother about it. I mean, this is such a foolish belief that the dancing peacock could bring rain. That's what we thought about it, right? What is this all about? That a weatherman today, he could be the better predictor. That's what I feel. But yes, there is a link. We thought it could be a rudimentary or some sort of a false belief, but that's not true. It's having its own repercussions. The peacock, when it dances or it vocalizes, it's always considered as a mating call, and it happens exactly before rain. Now we understand that it shows that the peacock is recognizing something which a weatherman recognizes, probably a drop in pressure, a drop in temperature, or humidity. Everything is contributing factor towards the prediction of this. A BBC algorithm, which is having about 90 parameters to put together to predict a rain at a particular place. So what we thought a dancing peacock, the peacock is dancing for a mate call for a reason that it is anticipating rain, and the rain will bring the worms and small insects will be hatching out, and that will be a good place for the breeding for the young when the peahens when they just giving birth to when they lay hens, and when the small ones, when they come out, they will be able to feed on them. So it's not that something that we always think of that some foolish thing is happening, some foolish beliefs, but there is something behind it. Here, maybe the eardrums of the peacock are sensitive for air pressure around, and how is it sensing? It's yet to know. There is nothing very super science about it, but we need to understand what is happening around. So this picture of C.V. Raman is always fascinates me. the C.V. Raman said one thing: history of science has always shown that a real fundamental progress is always due to those who has ignored the boundaries and treated science as a whole. Today we saw I'm an ophthalmologist, I'm a pharmacologist, I'm an anesthetist, I'm a cardiologist. But together, when I think that when you are looking together, then we'll be able to create it. It's not that only IITs will create it. We are capable of, but we need to think that, we think that as science as a whole, not some domain specific. See what happens is this, just see the C.V. Raman's pic. The C.V. Raman is standing on the table, standing next to a table where the blackboard just behind him is having the structure of retina. A physicist, hardcore physicist, was highly interested in retina to understand the functions when he was alive about 100 years back that we had no knowledge about it. So now what happened? I'm coming back to the same thing as Professor Mahipal said, that you publish paper in high impact journals. What impact it has made on my life? A common man is asking this question. I have contributed to your free education. I have contributed to your expertise. In return, what you have given to me? It's something like, if you are publishing a paper, you are harming more than that of you are trying to patent it. This is what is all about it. Although that it is very difficult for you to understand, but that is a thing all about. What is an innovation? Innovation is something that you recognize an unmet need. When an unmet need comes up, it's an opportunity. The opportunity, you try to address the problem, to meet the unmet need, and making something which making it available. So when you're just addressing a problem, it is also your responsibility to make it available for the person who is in need of it. Or what we try to do is that we try to push an hypothesis to simplifying the requirement. That basically that what you try to do is that you anticipate a problem and try to work for it. So I divide innovation into two types. So what is the what ultimately is going to reach is that the creativity plus work that is leading towards innovation. The invention and innovation, they are differing slightly. Innovation is defined as the introduction of something new or different. In the act of innovating lead to the introduction of new ideas, device, and methods. Invention, if you just like to split this word, inventing the process or device are some ideas. You are trying to vent out something which is something as a process or a device. But innovation is something that what has been vented out in which you are trying to bring a novelty. That novelty is going to suffice. For example, this is what a small thing which I could just think about it. A farmer in India is always in need of bore wells to pump water out. So the biggest problem when I was a kid, my father was supposed to go and operate a water pump at the farmyard. At the time that it is exactly, we used to get electric power at 2 o'clock in the midnight or in the early morning. We used to get electricity. So going at 2 o'clock, switching on and coming back. Sometimes you won't get electricity at 2 o'clock also. Today, a small innovation somebody has made it, which really attracted me. That a simple mobile phone, just give a click, it switches on the motor at somewhere at a different distance. Probably it is away from them today. Mobile towers are much more reaching than that of human being or through transports. So he switches it on and switches it off. So it's something that, this is how an unmet need is addressed as in the form of innovation. What exactly it makes it is that someone makes it happen and others wonder how it has happened. This is what all innovation is all about. The small insert here, it shows that the state of mind. A rainy day, a person is carrying an umbrella, in normal umbrella like you and me when we are carrying it. But really somebody wanted to harvest water, then this is the way how he tilts his umbrella and he makes the stem of the umbrella to collect water. So this is only thing is that how he placed the umbrella and the other way around. That's what the innovation is all about. So what is something like looking beyond? If an innovation is unidentified, it is blind to see. The one is blind to see the opportunity. You will always call somebody as blind. In ophthalmology, the blindness means something different, as we understand very well. But in innovation, if it is unidentified, that means that the person is blind to see the opportunity. Very interesting. So we have two types of innovations. One is our inductive reasoning. Another one is deductive reasoning. One is that you observe something and there is an unmet need and you go for identifying the problem and addressing the problem is inductive reasoning. But the other way around is that, like us, We give a topic to a student, and the student go for predicting it, and he does an experiment, and he come out with something to solve it. So this is deductive reasoning. So in either cases, you are trying to solve a problem by trying to bring the innovation. So let me just tell you something very interesting. I think when I was a small boy, I think most of you of my age definitely must have seen this toy, right? Can you believe that this toy has got a US patent? It's a very simple toy that we used to play with children. And that's this toy. You must have seen this toy. Most of you must have played on it. You see that? Now this is a small toy which converts the linear motion into a circular application. I think you must be remembering this full story. It's not that exact Chinese yo-yo. This is a much more Indianized toy I think I have seen in my childhood. My father told me when he played when he was young. So that you see that US patent sitting on it. I mean, let me just try to tell you that the most fascinating discovery which came from, innovation came from the Stanford University. The Stanford University put this very proudly in its paper communication.
From a technical spec point of view, we can match centrifuges that cost all the way from $1,000 to $5,000. But this is a tool that requires no electricity, no infrastructure. You can carry them around in your pockets for a price point of 20 cents.
We call it a paper fuge. It's essentially a piece of paper, and we put in small holders for capillaries that we can fill with blood. And we have standard string, and we take two pieces of either PVC pipe or wooden handles, and then you just pull on it gently. As you spin, the disc is rotating back and forth. It's rotating in an oscillatory fashion, and there's a moment when the disc is stationary, and then it starts to unwind and go in the other direction as you apply a force.
With this set of principles, we're able to essentially make a centrifuge that spins all the way to 120,000 RPM and 30,000 G-forces. In the lab, we can separate and pull out malaria parasites from blood. We can separate filaria, African sleeping sickness, separate blood plasma. It is an ultra low-cost centrifuge that's built out of principles of a very old toy, the whirligig.
This is a toy that I used to play with as a kid. The puzzle was that I didn't know how fast this would spin. And so I got intrigued and I set this up on a high-speed camera. And I couldn't believe my eyes. This thing, when you hear the noise, is actually going at 10 to 15,000 RPM. To me, that seemed like what we wanted to actually make a centrifuge.
Before us, nobody had actually understood how this toy works. So we spent a significant portion of this time truly understanding the mathematical phase space for how you can convert linear motion into rotational motion. There's some beautiful mathematics hidden inside this object. There is a value in this whimsical nature of searching for solutions because it really forces us outside our own sets of constraints of what a product should actually look like.
The centrifuge is the workhorse of any laboratory, from diagnostics to biology. And if you build a very essential, a key instrument, then you open up to a whole different variety of applications.
We just got back from Madagascar. We took the tool out to the field to work with health workers, and we're starting a clinical validation trial on a larger scale to share it with the community and the healthcare service providers, get the feedback. So it's a very iterative cycle. There is of the order of 1 billion people around the world that live with absolutely no infrastructure, no roads, no electricity. So for us, the inspiration is to make the simplest possible tools that do the job well, such that you can get them distributed around the world.
Now, this is an example I thought of quoting it that for just an idea how it has converted into a centrifuge, which calls a paper fuge, and which can run to the speed of 120,000 RPM under 38,000 G. That's something remarkable. That's something which came out of it. Only thing is that the way you try to think of, you don't need a fancy laboratory to do all these things. Sometimes what we call as jugaad, something, there is no equivalent word in English for jugaad, but jugaad is the innovation. And when I just try to explain students, and this paper came in Nature, it was subsequently got an award also. Now that's available. Similarly, I want to show you something else also. I think all of you remembering this drug, this plant called datura, which was there in Indian civilization for a long time, and it is there in our Vedic scripts too. And the datura is something like it was used in Ayurveda to treat lungs and throat for a long time. And you know this fascinating story behind it, I must tell you. It is offered to Lord Shiva in Shivratri. So we know there is some sort of a cultural attachment is there. In 1802, a British physician and an asthmatic, he was asthmatic, James Anderson, visited India with a British physician during British rule. He got a severe attack of asthma. So he went to an Ayurvedic physician. He gave this cigarette to smoke, that is datura cigarette to smoke. So immediately he got the relief of datura, and he gone back to England and shared with Dr. Sims in Edinburgh. So they published in Edinburgh Medical and Surgical Journal, and it has become very popular in Europe. Now it's about 200 years back, but therefore we really forgotten that. But you see that after several years, this cigarette was available. In 1894, this cigarette was available throughout England and as well as in Europe. And slowly the name of Indian cigarette has gone, and people have started giving their own names. And you'll be surprised to see, in 1966, the ipratropium bromide was a chemical substance which was derived, which is same to that of scopolamine, what we see in datura. See the chemical structures of both of them. It was patented. Then it came in an altogether new canister as an inhaler to us back. Now, what do you think about it? That's something that it was there in our civilization, which was there in our medical system. We lost it, and we completely lost the traces also. But when we just dig it back, we come to know that, the origin of it. Similarly, therefore, we need to look into all systems more holistically than considering, this is not allopathy, this is Ayurveda, this is Siddha. We should not look into that. For an innovative mind, everything is an opportunity. Look at this thing. An evacuation chair was designed, a simple chair in which somebody fixed a belt in the belt roller on the bottom of the chair, and this chair was used to bring the patients through the staircase during emergency, especially when the time of fire and other things. So this evacuation chair is the patent of somebody, a company, Stryker, and now it is sold for the price of $3,840. I think I just seen it sometime back in the exhibition. So the idea is economy for the country. The more and more you innovate, the more and more you patent, the more and more you bring it to business, the more and more foreign currency you get because of it, or even local currency, which to reduce the utilization of foreign currency, that is going to build up the nation. For example, this buckle, what you see here, was a small buckle, which we use it in the aeroplane, and you know that the patent is sitting on this buckle. So it's something like whatever you think of simplifying a process, you see the innovation there, and there is a patent. As Professor Mahipal said that, yes, there is an algorithm. When we send to copyright, trademark, I think Dr. Chitra will talk about all these things. I'm not going to cover it. But what I'm telling you is that when you have an idea of bringing a software, the software, the software cannot be patented in the normal way, but we have the innovative ways to do that. It can get into copyright, it can get into trademark, it can be all. If you try to figure out an algorithm, you cannot publish an algorithm, you cannot patent an algorithm, but you embed the algorithm in a software and you can patent it. And you see that Adobe Photoshop, you can see all these guys whom over there in the copyright. So this is how you try to protect your innovation in any way it comes in. So how the innovations are game changers. Just I wanted to show you this glimpse. I think you would have forgotten the TikTok ban, which causes immediate $6 billion loss for the Chinese company. But you remember that it was started by a Microsoft employee, BitAns, in March 2012, and Zhang launched a first mobile app. And that AI-powered mobile app has subsequently purchased another one called Musical.ly. Now it has become, within few months, it has become, it's a huge 200 million subscribers, and it turned out to be a TikTok in August 2018, and which gained such a subsequent financial income, and which could threaten every big giants throughout the world. Facebook, Netflix, Netflix, Spotify, YouTube, all of them are using inbuilt algorithm. The moment you search something on your Google, immediately you are being profiled. And even you talk in front of your mobile, you will get a intimation that you talk about that you want to go to Paris, and you will start getting some advertisement that the airfares towards Paris. So AI has been embedded in everything. So in ophthalmology, AI is having a bigger role to play. And there are several applications when they come to it. They're all targeting ophthalmology. And recently, the announcement of Google for retinal diseases, AI for retinal diseases is one of the key findings. So the innovation in ophthalmology is something not new. It dates back to 1300. Venetian crystal makers were given a special provision for making the glasses. The spectacles were made by them, and whomever has invented or innovated these things have been given a special consideration. So people always say that. No, that's not. That's the first thing in optics when it comes to optics. The glass comes into picture, and the first is some sort of exclusive right goes 1300. Ever since you see so many developments happening in the patenting process, but something that in ophthalmology, we have several avenues open for innovations. Especially whenever you look into the IOLs, there are several IOLs that I could see many of them are just about to, this technology is supposed to come into market. So, well, when in case of surgery, yes, ophthalmology always considered as a surgical discipline. And see that when it comes to surgery also, that there are many instruments and technologies which are inbuilt today. When you just look at the type of lasers which have been used, on the type of from the optics which have been used, on automation which has been used, it's showing several possibilities of utilizing it. When you just simply search ophthalmoscope, you will get 200 patents sitting on ophthalmoscope alone. A femtosecond laser lentotomy, which is something recently which made by a German company, that is developing a steering wheel or a cutting pattern on the lens to reduce the elasticity for presbyopia, is something that in surgical discipline, I mean, although that it's not made by scalpel, but instead of scalpel, it has been made by using laser. But what I'm trying to say is that a surgery also is possible to get into innovation, and the innovation can be patented by a way. It's the dimension of innovation in ophthalmology with intellectual property right, which when you just look into the overall picture, formulation and drug formulation come to be 19.4%, and glaucoma is a maximum up to 30%, 27%, equally retinal diseases. Dry eye and strial inflammation is about 15.8%, all others contribute to about 5%. These are all the innovations being filed in the US Patent Office. And many of them, like the Lacryset, Lacryset, Vetriset, I'm not going in detail about all these things. These are all coming as an innovative products into this. The drugs are old. We are not putting any new drug. The polymers are not something which is new, but the way through which it has been done, and it has been patented before it has been went for clinical trials or publishing papers. That made all of them possible. If you publish, you lose it. That's what we want to say again. Next one, a very small thing which I wanted to share, which is that a small speculum. See that our small innovation has come into the speculum. Whenever you put a speculum, you always get a reflected light on the cornea. Now, when you just see that they put a small light above it, which is a slit lamp fitted speculum, revealing previously unseen anatomical details, which also eliminating reflected microscope glass. So a very small instrument. I think it looks like a small Chinese product, which is having a couple of battery and an LED. And you see that has come as an innovation in ophthalmology. So there is a US patent sitting on it in 2018. For a small of this innovation, you see in next couple of years, it will be coming into your clinics. Similarly, that binocular optical coherence tomography imaging. So the publications are continuously the patents are continuously going up in this area. Now, one of the most hot topic right now is eyeball tracker innovations. Eyeball tracker innovation, whenever I just look into this, I always feel that, well, this is used for several indications, for market research, usability research, packaging research, human factors and simulations, or playing video game, and psychological research, or for other medical research. But I always feel that in ophthalmology, it can have a better use. But I yet to see somebody is working for strabismus or other ocular movements. I mean, this is yet to be explored for in these areas. But Apple wins a key patent reflecting the eye tracker smart glasses. Just recently, we got information. To some extent, I just want to put you one slide about the innovations we came across, right? This is something like the one which is soluble natamycin eye drop is the one which we created some time back. Now it is patent granted. Animal studies and human studies, we are completely published. And I thank my colleague, Dr. Namrata for helping me that to come out with this. And she's one of the co-patentee in this innovation. Next is Natamatrix, again, and another brainchild of Professor J.S. Titial. I mean, we could give the shape for it. It is a drug-eluting implantable wafers. The patent granted. Now we are going ahead with other trials. The next one is that the eye drop for postmenopausal dry eye. This is again patent granted. This next one is one of the key one, that is the trans-recon sterile eye drop technique. This US patent. This is a small, simple technique to transfer to make the drugs available for all the places where in RP center we have the luxury of having a pharmacy and giving all the drugs immediately. But the same thing is not available for many of the ophthalmology clinics. Therefore, this innovation will enable that kind of things possible. They can get any damn drug in any corner of India. So how much protection I get out of innovation? See, look, I just don't want to exaggerate the figures. There was a patent infringement. You know how much was the amount settled for patent infringement? 370 crores between two instruments. They got 370 crores settlement. So that in the same type of protection you get for your innovation if it is being copied by somebody. So only thing is that before publishing, you should think of getting, if there is an innovation, you should apply for intellectual property right, then immediately go for publication. Ocular diseases are dealt the innovation in ocular diseases are very rare. And I contribute to about 1% of the clinical trial registered in FDA registry. This has gone down. It has not increased so far. So avenues for innovation in ophthalmic sciences come from different areas like drug delivery systems, surgical aids, diagnostic agents, diagnostic instruments, diagnostic aids, societal innovations, intelligent readouts, software embedded algorithms, all inculcate. I mean, all what you need is that you have to inculcate out-of-box thinking to make all these things possible. The unmet need gives an opportunity and it gives an innovation. Once if we come out with the idea or concept, make a working model in the lab scale process, make a prototype in a small prototype. At this time, you make a partner, commercial interest with the investment, or you take from angel investors or from ventures. I think it will be dealt separately, how to take it further, and the production of marketing, in which you have to make a lot of contracts, you have to preserve. One of our colleague in AIMS just went and just casually talked to somebody, and he made the patent, and he started a company, he floated the product. But this one of the faculty came and told me that, say, look, sir, I went and discussed with them, and this guy is doing like this. See, because that contract has not been made between them. So there are some couple of things to protect your interest. I think that will be dealt by subsequent speakers. I'm not going into it. The government of India is encouraging so much about startup and innovation. Innovation is always unlimited. Have a small, just I want to say something. The innovation is always something that you just try to put something for a special use. This guy is using helmet to avoid the itching of the eye, irritation of the eye. And this another innovation is having mobile phone in the helmet. Well, so this is a nice way that I know how somebody has created a basket as a transport service. And this is most innovative one that now you instead of using all cattles, now you have something else. And if your two-wheeler is stolen, that you may find somewhere pumping water in the farmer's farmyard. And see, this guy has found an innovative way to cool his drink for the evening. And this is a more ultimate one that now he can get into a temple to pray comfortably, locking the chappals outside the temple. That's something very innovative. He is owning a Maruti car, but he just only doing another cycle. So these are all very small innovations. Another guy has got a simple hot water innovation. So these are all just for fun, right? Among all, the most interesting one is this. I mean that the last one is that I just show you. This is the most innovative one. He found a formula to keep his wife as well as mother-in-law happy by putting them together on the back of his bike at the same time. There's something like to put you with a light mind about innovation. So in a nutshell, that if I want to say that one who acquires knowledge and then passes it to others, gets all his wishes fulfilled and achieves the success of happiness and prosperity in his life. This is what quoted in Atharva Veda. So with this, I am just ending this talk of innovation. Innovation always out of box thinking. Thank you very much for giving me this opportunity to talk to you. Thank you very much.
Oh, thank you, Dr. Veelpandian. I think it was a fantastic talk and you covered everything. So many things you told us which we were not aware of at all. And so interestingly put that the whole talk, was so energetic, full of energy like you are always. And thank you very much. I think we'll take the next talk now by Dr. Chitra Arvind, and she's going to be talking about intellectual property protection for drugs, biologics, and medical devices.
Thank you, Professor Namrata, and thank you, Dr. Veelpandian, for such a scintillating and exciting, you set the tone for the entire seminar. And I also thank other people, especially Professor Sachdeva and Dr. Shetty for, giving a good introduction. It actually shows that all of you, do know about IPR, and therefore I'm not starting at a very, very, normal pace, because I'm starting at the level which I believe that all of you know IPR, which I believe is the truth. But I just want to say that, all of us are actually quite partial to ophthalmics, in the sense that, we do consider that the IPR in eye is very unique, is very special, and it is very specific. Because, an oral drug cannot be equated to an ophthalmological drug. It has completely no pharmacokinetics. Okay, the pharmacodynamics is different. The excipients that are to be used in any ophthalmological product is different. And it is true for every device, the sensitivity and the miniature nature and the perfection which is required for eye as an organ is quite different from what we are going to use for the rest of the body. And this fact is recognized in all patents which are granted to ophthalmology. I want to stress upon this because the bar for inventive step and the bar for novelty in a patent application meant for eye is completely different from what is required for the rest. And I would like to give examples as to how such patents have already been obtained. Whenever you want to look for an ophthalmology, we can think of various kinds of patents which can be possible. Of course, we have biomedical devices. We have compounds which can be either new chemical entity or compositions which are in way otherwise formulations, processes, method of treatments, and new use. Now, a lot of people opine that, method of treatments is not patentable. It is true for some jurisdictions. However, if you have a new method of administration or treatment of a drug, though it may not be patentable in India, it certainly gets patented across the globe, in US, in Europe, and other places. I would like to state here a principal rule of patent application. To get a patent granted in any country, the search for the patent is done across the globe, but the enforcement of the patent is as per the law of the country in which you apply the patent, and it can be enforced only in that particular country of choice. Suppose there is a new use or a new method of treatment for ophthalmology. It certainly does not get patented in India, but US and Europe are very good markets. So whenever you want to patent a subject matter, it is possible to patent all kinds of subject matter. But we have to see how the disclosure has to be and what should be your ultimate aim and what is the country that you need to target to enter this. So first we have to identify the subject matter and basis. Let me give you an example. This is a granted patent in US, which is on an intravitreal injection device. This also includes methods for injecting the substance into the vitreous chamber of the eye. So this is a granted patent in US. If you will see, this is a device patent. It talks about the device and it also talks about the various parts of the device and as to how it is. The difference I want to tell here is most 97% of the patents across the globe are for incremental inventions only. Supposing, from AIMS only, we had one patent application which just changed the angle. But because of the change in angle, the physician was able to access areas which was hitherto not possible with the earlier device. But this change in angle created a huge advantage during surgery. People would say, it's a small change. Why to go for a patent for the small change? No, the small change lead to a huge effect, like the ripple effect, which Dr. Pandian was discussing. So do not disparage even simple changes of your invention. Simplicity is not a bar for patent. Do not kill your invention at your own end. Please go to a professional, and this change in angle, whatever effect it made, that becomes a patentable subject matter in any device. There is also, as I said, method of treatments for eye, which is quite possible to be granted across the globe. This is one of the US patents which got granted for a method of treatment in the US. So this is quite possible to have even methods of treatment. Only the jurisdiction of choice need to be selected very carefully. Since I gave the last two examples as US patent, I would like to assure and assuage you that even in India, we give a lot of special treatment for ophthalmic patents. This is a patent which has been recently handled by our firm and which got granted. This is ophthalmic bevacizumab. So this is what I'm sure, I'm not going to talk about the clinical symptoms of bevacizumab and before elite ophthalmologists. But, when bevacizumab was administered for AMD, where a lot of this AMD, they used to use the cancer drug for bevacizumab. They used to accumulate patients. They used to administer this bevacizumab for 10 or 12 patients. But some of these clinics did not have, the proper way to keep its storage stable and sterile. And assuming if 10 or 12 patients did not come, the cost, which was around 60,000 rupees per vial, had to be distributed among the number of patients who had and where it had to be opened. But there was no chance for people to keep the bacterial endotoxin or the particulate size or the aggregate size once it has been diluted constant. Now, one of our Indian companies has come up with a pre-filled syringe of bevacizumab at a very affordable cost. Okay? And wherein, they were able to maintain all your BET, all your particulate size and the aggregate, and which is at a cost which is affordable per single patient. Okay, so people would think, we had a drug which was only, diluted and administered to 10 patients. What is it now? It is very important because WHO has placed this drug on the essential list of medicines to be picked up and worked by an industry.
Hello.
What is the inventive step and the inventive merit in this particular application? The ability to control. But what is the effect? The effect is less irritation, less toxicity, and the economic advantage which could be offered to a patient. And this is a granted patent in India, and it is expected to be granted in several places across the globe. Why I would like to say this? See, as I said, if it was an oral composition, which was perhaps in capsule to that of a tablet, or you make it as a solution, the bar of the inventive merit is a little bit more higher than which you use for ophthalmics. In ophthalmics, because it is a sensitive organ, okay, we can show the n number of advantages And based on this n number of advantages, it is possible for us to obtain patent. Again, I would like to reiterate, the small, simple steps can lead to a great effect. And that is what needs to be thought out and placed in an application while obtaining a patent application. So what are the 3 important steps that we need to do before we think of our invention as a patent? First is to examine the prior art. This is done by a procedure which is known as landscaping, or which is known as, a white space analysis. As I said, we are not always waiting for the apple to fall from the tree and, find a completely new, different concept or invention. Even small incremental inventions can be made, assuming that that's something that you thought out of the box. So what would we do? First, we will have to examine what other people have done. What is the gap that is required? How this gap has been sorted out. Okay? And we cover that particular gap. That becomes an invention. It is very essential to examine the prior art because we are not going to reinvent the wheel. And the second thing is, if somebody is already having possession of that particular invention, we do not want to get into a legal action because it is quite possible, if it's Alcon or some other person, they can come and sue us. So the first step in obtaining a patent is to examine the prior art to ensure that what we are doing is quite different from that of the prior art. Every patent application gets granted on 3 tenets of patentability. One is novelty, the second is inventive step, and the third is utility. In case of a novelty, we compare our invention exactly with that of the prior art invention, and it is different, then you get a novelty. In case of utility, if there is a use which has an industrial application or a use in the terms of end user, you get utility. The bar becomes the inventive step. The inventive step is if you have done anything different from that of the prior art, which you must have done, they quantify the difference and see whether this difference is obvious or non-obvious to a person skilled in the art. Earlier, I used to work with a pharmaceutical company, which was specializing in ophthalmics. In this pharmaceutical company, there was this budesonide, which was getting administered in the eye, which was getting administered as a suspension. Okay, the whole world tried to break the budesonide suspension. Okay. Finally, they did close to it, they tried to break it, and they tried to enter it. When they tried to enter the market, the innovator changed the suspension to that of a solution. As ophthalmologists, all of you would know the difference between administration of a suspension to an eye and a solution to an eye. So the entire generic pharma had to drop what they had to do and again start with solution. But this conversion of a suspension to solution has that step, okay, that change, which change gave a lot of advantages to that of the end user. And this change is the inventive merit in this application. Again, it is not only, necessary to limit this to that of, pharma, even Ayurvedic compounds. Recently, we patented one Ayurvedic compound, which can be used orally, but to treat diabetic retinopathy. Again, this concept is completely new. Okay, to use a solid oral dosage form, which has an effect in eye without any toxicity. These are the differences and the different kinds of inventions which do get patented in any particular place. Now, the second question people would ask is, even when you submit a patent application, at that point, people only ask whether the fee has been paid. After 4 years down or 2 years down the lane, depending upon the patent offices, the patent application would get examined for all these questions, whether it fulfills novelty, inventive step, and utility. In addition, the patent office also poses certain questions, which is based on the non-patentable subject matter and which differs from country to country based on the public policy of each country. Okay, but unfortunately, at that point, we cannot add anything in the patent specification. So when you draft the patent application and submit it to the patent office, all information when you do it in the complete has to be comprehensive, and we need to predict what the examiner is going to ask. For example, if you are going to have a new form of a drug, okay, you have to put in your patent specification the advantages. It may be either efficacy, it may be toxicity, or it may be other pharmacodynamic parameters. Supposing you are going to use a formulation, the formulation must show in the specification that it is acting in a synergistic manner, either between the actives or between the actives and the excipients. Or for example, if you're using a device, okay, or it's, whole system of an ophthalmic system, like a surgery system, you have to show that even though the elements are known individually, the combination of the elements leads to a better or a different effect, and it is not a mere arrangement or rearrangement of known elements. Unless you place all this in the specification, when there is an examination, there will be an objection. Unfortunately, when there is an objection, it is not possible for us to submit additional data, and we have to rely upon the data placed in the specification. Therefore, we always recommend people, because it is important to file first to protect your IPR, file first as a provisional application. Over the year, you discuss with your patent attorney and collect all information which will be essential to demonstrate the application and overcome the objections which would be raised in the prosecution, and cover all of them within the period of the 1 year. So you file a complete application over the period of 1 year. It would be still considered that your application has been disclosed on the date of the provisional application. So you get 12 months time. Buy this 12 months time and complete the invention, so that what you have invested in terms of time, energy, resources, and maybe financial also gets covered completely, and the patent application will sail through during prosecution. Okay. As Dr. Sachdeva said, patents is not the only form of protection. Patents is a statutory protection. Okay, whenever there is a technical improvement, you will have patents. Whenever there is an aesthetic appeal, like for shape or size, you can file it as a design application. Supposing you have a complex ophthalmological device and it goes through integrated circuits. So there is also a protection which is available for integrated circuits. These IP, you get protection only when you file them, and they are known as statutory IPs. There are also non-statutory IP, like for example, copyright or trademark, where it is not necessary that you need to file. However, if you have to take action on somebody, like say, for example, when somebody said, Professor Sachdeva said that people had changed the name. Okay, so tomorrow, Netralia, you want to change to some other name, and people are trying to, bank upon, whatever Netralia has gained in terms of reputation. That will be known as passing off. Still, Netralia can sue, but if Netralia has their own trademarks, it becomes much more easier. So though copyrights and trademarks need not necessarily be filed, the reputation and the author becomes, more important. It is good to have these as, trademarks and copyrights. For copyrights, all your literary work, your procedures, your protocols, your software which are involved in all those devices get protected in copyright. In case of trademark, okay, all the graphics and the logos, whether it is 2D or 3D, the name of your organizations or the name of your products or any service marks, all become this. Of course, there is trade secrets. Okay, so I would always recommend that, you should look into a combination of all this. Let us, for example, take, a new surgical device, which will help you show the eye in 3D when you do a surgery. What would you do? The technical improvement you will file as a patent application. Okay, the device per se, you will file it as a design application. You will have a circuit in that, which talks about the surgery and how it shows in a 3D image, how is it connected to the computer. That will become a part of the integrated circuit protection. You will also have brochures on it. Those brochures will get protected under copyright. You will give a name to that particular device. That device will get protected under trademark. Naturally, of all this, there is some training involved in your doctors who are going to be working with you in your organization that you will maintain as trade secrets. You should think of IPR portfolio like a dartboard. So the bull's eye is your product. You need to cover it with layers of IPR. It doesn't mean that, you are going to sue everybody who wants to come. Tomorrow, if there is a clinic which is, sitting in one corner of a very low income area and they want to use it, you can, very well gift it for free. But if tomorrow, you will say some particular big organization wants to steal your IPR, okay, it is better for us, to have these protections tomorrow. One, so that you can use this protection to license and gain funds. It is your money. You can choose to give it for charity. The second, if somebody wants to infringe on your IPR, you can tell them, sorry, this is my IPR. Okay? But in all cases, it is essential to have it in your place. So I would like to, summarize and conclude. Remember, you should not step into others' toes. So before you have your own IPR, you need to understand what is the IPR which is already existing in the area. You need to have a comprehensive IP protection, which needs to have, all facets of IP. There has to be a complete disclosure of the subject matter. You cannot keep secrets, just like you are doctors and you would expect the patient to tell everything to you. Please tell everything to the lawyers so that they can give you a complete disclosure of the subject matter and protect it. Every small improvement, updation is possible to patent. Incremental inventions are used. Unfortunately, there's a lot of legal requirements and documents which goes hand in hand with science, and patent is a techno-legal document. Only when it's techno-legally correct, it becomes a techno-commercial document. So please use good professionals to cover all legal aspects and all formal requirements so that it is a good techno-legal document which can become a techno-commercial document. Thank you.
Thank you, Dr. Chitra, for a very nice and comprehensive talk on this. And as you said, we should have a legal opinion. We have our legal consultant with us, Dr. Banusri, who will be discussing with us about protecting interests in research, collaboration, and technology management. Dr. Banusri, please.
Thank you. Okay. So today we are also going to see, apart from the way you can innovate and the ways you can actually protect it, we are also going to see the legal repercussions if you're not going to protect it, or even in spite of protection, what can be the other reasons where you should be legally aware of your rights and the ways other can violate them. So let us go. So if you look at the IP, which has been actually protected, even then, it can be used as a leverage for 4 or 5 aspects. In spite of everything, you have to be aware of what is happening and how you have to move forward. Either you wanted to actually undertake the actions on your own, or you want to actually give it to a third party to actually take it forward. So the funding is the first thing what comes on to every innovator's mind. If he's in academia and the academician's first thing is, okay, I have an IP, which is very good, and IP requirements are there in many of the funding schemes that are floated by different ministries. I want to get the best funding possible, and international collaborations based on that. And the publication, yes, that is also in mind, the good peer-reviewed journal with a good score on it. And the monetization, which will also yield you royalty or any sort of a benefit sharing. So as we have heard till now, that it is not easy to actually protect your IP once you have even got the grant of patent through a statute. So the both statutory and non-statutory aspects of IP we have seen. So just because you don't want people to communicate with you or you don't want to talk about doesn't mean that you have protected your IP enough. So there are very many ways actually you can think of to keep communicating about your IP that has been protected, still actually protect it also. So it can, the new ideas are proof of concept, technology development, application identification, application development, technology transfer, commercial scale up, and market development, which are the significant steps in any product's life cycle. You may have to face challenges at every step, right from the concept till the market development of the product or the services you want to offer it to the public. So yes, once you have a funding scheme which has actually taken you to the last round, the recommendation of the Apex committee has come that you are going to receive the fund, you feel that yes, you are free, I can practice this patent. We can understand the enthusiasm. So because we have a lot many funds which are sitting over there, which are just for proof of concept as discovery funds, which can be for the validation and scale up funds with a cap or without a cap. We also have clinical trial funds, even up to 100% of the grant that is involved. But probably the implementation side, what they are looking at as funding agencies is India, not abroad. So if you have a multi-country clinical trial, that means Indian trial will be funded and not the areas or the sites which are outside India, if it is a government agency which is funding. So we are also looking at technology development and de-risking funds, which may be at a later validation stage, where you also look at translation, where you also have an industrial partner, you have identified them, you can go along with them. We have patent protection funds specifically by many ministries, including the startup and stand-up programs, and also the patent policies of our country, which allow for specific innovations, which are through academia, small-scale industries, and DIPP registered startups to go and MSME registered companies to go ahead and have some sort of a concessional rate for protecting their IP. We also have technology in licensing funds. These are very specific, which are termed as technology acquisition funds, where you have identified the technology under an international collaboration, and the government of India.
Still 2 to 3 millimeters beyond the margin of the region.
Yeah. Somebody else is talking. Should I continue?
Yeah, please go ahead.
Okay. Okay. The market entry funds are very specific product development funds, which are also given by certain, ministries, including BIRAC, which is under DBT, for actually giving the product to an industry till the last stage, pre-commercialization, validation, and scaling up, so that they can be market ready when you go for the expansion funds. So whatever may be the nature of the funds, you have to look at the scheme, what it is specifically, and depending on the scope of the scheme, you have to put your project applications and the scale to which you are looking at, also the synergy between the organizational mandate, the scheme mandate, and the saleability of your project itself, where you have seen that the timelines and the deliverables are going to match the scheme mandates. So if these things are put in place, probably you will have a brighter chance for the funding organization to pick your projects. So definitely, as a lawyer, I have been looked, in certain way by the people who say that, oh, why the lawyer is there in the beginning itself? They can come at the last stage, as a last stage, to protect everything once we scientists decide everything. That's not going to happen. If it is going to be the right way, you have to actually call a lawyer at a stage where you have already started, through the negotiations, as well as through the firming of your terms and everything, so that, you don't have to miss out any of the legal bottle plates and other things, so that, you can be protected, your IP can be protected, and you will get the maximum benefit out of the sharing of the resources and the commitment made. So yeah, this is a joke where we say 1,000 lawyers chained together and dropped into the ocean. People say, oh, it's a good start. Let us go ahead. Let us have a peace, mental peace, So as we are rightly stating that whether you want to do it in your own setup under the lab to propagate your own IP through your own students, you should have the right people who may be interdisciplinary in nature because there may be artificial intelligence involved. You should have the right processes where you have to plan and source all the, equipments, maybe common facilities we are looking at or a core facility, but right work which has to be focused on the right systems where you can actually look into the performance of your own IP happening in your lab. For everything, there has to be also a documentary setup or a template made by you. If you have a student coming in who will be working in a project, already you have a protected IP, please make sure that you also have a template wherein the disclosures and the confidential information safekeeping is also made part of the student undertaking. So these are templates which I have not seen in many labs, but it would be good that if you get a help of a professional and put all these templates in place where a person enters, maybe even a trainee for a 2-month period. So, but then you will have to have these templates and undertakings so that the lab as a team is not going to exploit one another, but they are going to perform under certain set norms. So if you're actually going for a partnering with an industrial partner or even another academic institute for taking forward your IP, what you have protected, then there has to be a formal or informal. Both ways you can do it. Informally, you can talk to your colleague from a different laboratory or a department and say, okay, let us go ahead. We will put a joint application. We'll get a joint grant. Let us go ahead and make a product. But yes, so this will have more risks. Once there is IP stemming out of the implementation of the project, then both of them will have differences. What is your component? What is my intellectual contribution? This is not right. So this is not the way to share the benefits. So there will be then less certainty and less credibility to the partnership itself. Therefore, it would be always preferable that you have even though if you have an iterative negotiation, you have inter-party problems, you have multi-jurisdiction. But if it is in paper, if it is in writing, two or more parties coming together can have a better understanding on the roles and responsibilities, how to implement the project, how to take ahead the monetization or validation of the IP, and how to find a deliverable that will yield benefit for all of them involved. It's a win-win situation. So definitely when we look at this partnering, there is a conflict. If you look at all this, I have in our study from BIRAC as well as TDB and other government agencies, you are seeing 60% of the research funding comes from government sources, 18% from their own university or institutional sources, 10% from private foundations, including international charitable organizations, and 5% from private industry, where you have gone ahead and found an industrial partner, and the industrial partner is sharing the cost of your product development or even the technology development prior to validation. So these are all, the areas where we have to pick up, grow more trustful of the industrial environment and find partners who can take us ahead. So the collaboration planning, receipt of funds, intellectual property management of individual collaborations, or even evaluation of individual collaboration results, all depend upon how you can comfortably sit across a table, heart to heart and partner to partner. How can you actually do a formal writing up or firming up of the terms and conditions? So once you do it, beware of side deals. I have also seen academicians who also enter into side deals or side letters once a company comes to them. There will be a standard template for a partnering or a collaboration agreement, and they will do some side letters. They will say, okay, for this specific project, let us go ahead for a specific terms and conditions. But definitely beware, because that is not going to supersede what is the law of the land or what is there already in your pre-existing agreements. So be careful what you are going to actually negotiate and come up with as a written agreement or even side deals with your industry partners. Yes, definitely. I have seen academicians saying that we as academicians don't want profit. We don't want to sell anything. We want to publish. We want to get the fame. We want to get the repute. We want to get the funds for the labs. Yes, definitely. That is one area where there is a conflict of interest when you look at it. And you also have a broader mission of development, which is for public use rather than actually for a industry controlled R&D. So the academic liberty or the freedom, that is a pride of all the professors and scientists. So that gets challenged when you look at partnering. So also there is an early stage and closer to market. The fundamental research is the prerogative of an academia, and the closer to market research or validation becomes an industry activity. And we have grants on one side where you just want pure money flowing in for research purpose only, and also the profits which is getting eyed by the industry partner. We also have increased commercialization of university research agenda as a criticism coming from different parts, where they say, if you are going to handshake with an industry, that means you are going to deviate from your not-for-profit or altruistic mandate of doing only the research for public good. So, and you will get distracted from the basic research. So in spite of all the conflicts, I have seen that in the present stage, people have been coming up with different partnerships, which is also good. We cannot stay away in silos and expect that things are going to be good and the product will reach the market. Even for people to get access to the technology, what you find as the best glowing technology, you should have to partner with an industry mind. You don't have, I have seen scientists are very good administrators, very good scientists. We are problem solvers, but definitely we are not sellers. We are not going to do the sort of a lobbying which is required for taking it forward before the market. So let us leave it up to the industry. We can partner with them and we can see the light of the day. So, as I rightly said, because of all these conflicts, we see industry and academia as oil and water. But when you actually mix it up with them, you can see a lot of colors flowing in, a lot of patterns coming in. So which will be good for both of us, right? So as a whole or as a part of the patent, both can be actually transferred to other parties. It can be a property in true sense where you can actually give it to your children through lost will. As judgment, you can actually put it as a security and collateral for your loans. So these are exactly the properties what you're looking at when you look at an immovable property or a movable property, as we know in common parlance, like a land or a jewel. So intellectual property is almost an asset which may not be physical in nature, but definitely it will have both the properties of either a movable or an immovable, where we are looking at transferability, transactions, and the legal value to it. So there are differences, the way you can give it up to the third parties, because you are the owner, you are the inventor, you are the applicant. So both the terms determine that you have some stake in the invention that you have made as an academician or a professor. We can either license it or you can actually give the entire patent on assignment. The assignment means that definitely you are giving away your ownership. There is a transfer which is irrevocable or irreversible, and the new assignee becomes the owner of the patent or the IP. So we have to be careful with these terms of licensing or assignment. If it is just a license, that means you are going to actually dole out a part of the patent rights, or you are going to give the entire patent right on a non-exclusive basis or exclusive basis. That is when the creativity gets translated into an access or opportunity. So once these processes are in place, there are also stamp duties like we do for property transactions. We also have registration processes. And if it is going to be a biomaterial, all these biomaterials have to be deposited at International Deposit Authority also, which is IDA, and under the Biological Diversity Act of 2002. So these are all very few things, because we also are coming up with the stem cell area where we think there is a lot of potential. Also, there are a lot of risks, because there is a difference between stem cell research and stem cell therapy. We cannot call it a therapy unless it has been established that it is out of risk, or at least we know the risks which are involved, and we can actually enable the patient to give an informed consent on it. So definitely, if we look at how people actually take it forward, the companies take it forward, how new companies get formed using an IP, you see the timing is great. Yes, you have a new IP, you have seen that this is the need of the hour, and you have a demand in the market. The timing is great, which constitute 40%, 42% for it to be a winner. And team or execution is 32%, where you have the right team, where you have already having partnering going on. And the idea itself, which is an outlier that nobody else has thought of, it is 28% of factor for becoming successful. The business model, where you look at an approach globally or an inland market, or how you want to go about it, 24%. And funding is definitely there, but It is not a very significant factor for a startup or a spin-off or a faculty-driven enterprise to become successful. All of this will be possible only you have the first winner, which is the legal support. So yes, we may be a nuisance, but we are the needed nuisance, essential nuisance. Yes, at all timing, on all the steps, whether it may be pre-patent grant or the post-patent patent grant, you need legal support so that you protect yourself, your IP, and you don't step on the toes, as rightly Dr. Chitra said, and you can actually save yourself from any sort of a legal action or claims against you. So this is where we say, as a fraternity, we say we don't have to be victim of bright, shiny object syndrome. I've seen this with many of the scientists who think this is my best baby. This innovation is the best I have got, and no other scientist has got this. So this best baby syndrome or the bright, shiny object syndrome actually can weaken you. It may be your strength when you want to convince others that, yes, give me the fund because this innovation is good. It may also be your weak point because you will never be able to accept the criticism of the other well-wishers who want to see that this product, when it wants to go to the market, there are certain areas you have to work from now. These are the areas you need addressing. So we have to be very careful as innovators to not become a victim of BSOS. So when we talk about the legal arrangement or the legal support, starting from the day you want to communicate with any other third party, the legal support has to be there, where we call it as a non-disclosure agreement for confidential information. Or you want to have a student in your lab, you have to have a lab undertaking. If you want actually to sit across the table on the end of that very day, put a term sheet on paper, just a pointers that you accepted this, we discussed this is what we want, these are the things which we will discuss in future. So this is called a term sheet. It is a very sort of an informal firming up of the aspects what you have discussed with your partner. And the letter of intent, if you have further industry coming up and they say, yes, we want to partner with you, or the memorandum of understanding, here, I want to see that you understand the difference between memorandum of agreement and memorandum of understanding. The agreement means it has a legal binding component. Understanding is an umbrella understanding between two parties where we want to collaborate in a certain area, do certain activities, see where it goes. But then agreement means you have actually pictured what is the role and responsibility of both the parties. You have everything in place. You have committed your resources. You know what is the funding component. You know the budget specifications. You have got it actually. What is the IP governance will be there. If there is going to be a commercialization, what will be the benefit sharing? What will be the royalty payments? So how this will end or how it will terminate or foreclose, and the dispute resolution. So all this, if you have thought out, that is agreement. Whether it may be collaborative agreement, whether it may be resource sharing agreement, licensing agreement, consultancy agreement, invention assignment agreement, joint contribution agreement, benefit sharing agreement, outsourcing, contract research agreements. Here in the contract research agreement is also called outsourcing, where you do not have to worry about any sharing of your data or sharing of your intellectual contribution, because it is like a person is going to give you services, gets the payment and gives back the data to you or the results to you. So this is the area where you have to be careful that there you should not lose any of your rights. And we also have deeds. The deeds may be hypothecation deeds, deeds may be even mortgage deeds of your IP, collateral deeds of your IP for getting a support, or even commitment deeds for public procurement, etc., based on the mission under which you are going to get the funding. Definitely, there will be a separate funding agreement also. If it is grant, soft loan, doesn't matter. You will have an agreement which you will sign the dotted line. And I would request all the scientists, though you say it is a legal document, you please read the terms before entering or signing those. Awareness is the key, and ignorance cannot be an excuse. This has been told and told till the time we actually, we have lost the brains on that, but then people have been careless. So I will talk about humanitarian commitment and access agreements also in a little while. So when we look at as a grant giving organization like BIRAC, where I have worked, TDB, ICMR, we look at both the things, technical as well as the financial aspect of a project when it is projected. The due diligence will cover both the areas. What is the pre-existing IP? What is the background IP? What is the in-house strength? How are they going to strategize the implementation of the project? And once the funding goes, then how are they going to utilize? How are they going to give the statement of accounts? How they will protect the project IP? How they will acknowledge the grant? This may sound simple, but you have to acknowledge the grant. The acknowledgement does not mean endorsement by the funding company. Acknowledgement that this product has been funded by DBT does not mean the liability of the product or manufacturing anything will rest upon DBT. Nothing goes to DBT, no liability goes to DBT. It will still be with the innovator or the manufacturer. So acknowledgement also comes with a legal disclaimer. So the royalty, if they want, the funding agency itself wants, that will be well above the royalty the academia will get from the industry partner on sales of the product. We have to be very careful on these aspects so that we have an understanding when we go for partnering. So this I have already told you. So even then, I know no need to actually note them down, but I have just put in the elements of an agreement. When you want, it will involve the not only the technical aspects, the financial aspects, but also the boilerplates, which will be like negotiable clauses on damages, on force measure that which goes beyond the control of the performers, whether it may be the transferor or the transferee, licensor or the licensee, collaborating institute or the collaborating industry. So these are things where we describe that the interactions or a relationship or a partnership, there are definitely challenges. So we have to have the perspective to see that everything is taken care through the legal arrangement, what we can put. It may be contractual, it may be non-contractual, it may be a gentleman handshake, but something should be on writing, at least as a commitment letter from both the sides. Please don't hesitate from getting them in writing. It is not that I know the professor, I know him, the reputation is so high, that lab is going to perform for me. Please don't do that. It is not going to be healthy always, whether you are there in the seat or not. This has to happen. The implementation has to go on. The funding agency will want to see the contingency plans put in place and the risk being averted by putting the arrangements in place. So please be careful and be reasonable. And I think in these days, present days, people will not hesitate to bring something in writing also. Because I have seen that 60% of the scientists in our survey do not have any engagement with the industry. They hesitate a lot. So please don't hesitate. Probably you will have to find someone who is having interdisciplinary knowledge, Dr. Vilpandan being, IPR in charge. So people who have touched upon the legal side and then walked back, so they can even give the confidence to the other scientists stating that, yes, you can be there successfully, you can enter, and like Abhimanyu, you need not be massacred. You can actually come out from that chakra also. So that is very good that, people should have the trust among the partnering industries and go ahead with the written agreements. Definitely devil lies in the details and you have to organize the thinking. I know you take 1 or 2 confident days when you want to go on the table and bring the industry partner and you tackle all the communication issues. Don't wait for them to communicate. There is no ego involved. There is no academic ego or an industrial humility. There is nothing like that. You set the expectations clear so that both the partners have their says well before the agreements are put in place. That's why I say there is a lay perspective, how you look at it, and a lawyerly perspective. So lawyerly perspective sees that even if it sounds stupid, please put that as a clause in your agreement. So coming together is just a beginning. Keeping together is a progress, and working together will only bring you success. So don't worry about these Latin terms that lawyers fancily put before the doctors. Don't worry about them. Whatever it is, they are mainly based on logistic legal principles and rules of interpretations. If you look at the judgments, you will see that as a lay person also, you can see that when the facts are in this given set, then you also expect deliverables of judgment in this given set. So there is a logic behind everything. Law is not so complex. You can always embrace it to that extent so that you will get your protection. When we are looking at the technology management, the Association of University Technology Managers give 9 principles which the universities and the academia should be aware of. They go for partnering. They say universities should reserve the right to practice. They should not give exclusive license. Even if they want to give exclusive license, it should be structured in a way so that it will not, the entire patent will not lose the non-exclusivity. They want to minimize the licensing of the future improvement. Don't actually make a commitment that the future improvement will not or will also be automatically becoming part of the license. Don't do that. Maybe a later agreement will be a better option then. Manage technology transfer related conflicts of interest, including dispute resolution or alternate dispute resolutions like mediation or even arbitration, which is very, nowadays internationally, they are all well accepted as a dispute resolution mechanism, binding on the parties, and it would be less expensive and probably not so much draggy as we do in our civil or criminal suits, civil suits or criminal action suits, where we have, we have to go before the court of law and the criminal actions go on for years and years. And police involvement, which is probably a deterrent if you look at scientists and their way of looking at way of things moving forward. So the enforcement action, therefore, should be carefully considered. And if we are looking at international partners, please be mindful of export regulations, because the export regulations offer an exclusion to fundamental research projects or fundamental technologies. But if you lose this, that means you will be treated as a commercial product. You will be amenable to customs, duties, all those GSTs, everything. So be careful and mindful of export regulations when you have international partners. If you have implications, you will have a lot of implications when you work with patent aggregators. Patent aggregators are those industry partners who want to have related patents in a bouquet form with them exclusively, so that when they want to, launch a project, it will be their own domain. Nobody can challenge them. But there are two types of patent aggregators. You can see them as patent trolls, which is very negative because they are not aggregating the patent for goodness sake. They are doing it because they are on the watch out for other scientists, other industries to violate the patent so that they can bring legal action on them. We also have value addition patent aggregators. They are good. The technology flipping should be avoided. And if there is a proprietary information involved, please be sure that you reserve the right to practice and fundamental research so that you get all the statutory exemptions. There is restricted party screening that is very important, because if you are going to have a partner from China, Pakistan, or other areas where you see that there is a national or a UN blacklisted country. So all these things also you have to be mindful, because those said and done, you may be an individual institute and an independent scientist, but the international scenarios do make a lot of difference when it comes for technology transfer, sharing of resources, and collaborative research. And side deals, I have already told, which you have to be very careful. Oh, definitely, Dr. Velpandian also touched upon the subject. The common man is always on the watch. Though he is very silent, he wants something back. He doesn't demand it in open manner, but yes. And the funding agencies nowadays are also very much aware of this sort of an giving back to the society. You will find clauses in Bill and Melinda Gates, sort of a funding agreement, welcome trust agreement, joint Indo-Finland agreements called as global access and humanitarian license. There will be supply commitment for developing countries. There will be affordable pricing for India market. So these all things are the clauses. Now government is thinking, because if there is a public funding involved and the product is getting developed through public funding, that means the public at large should have some sort of a leverage, because the cost of production or manufacture has been taken care by the government to a certain extent in the life cycle of from the concept to the market. So these are areas you have to be very careful when you have a funding agreement. You have to actually look into these clauses, because when you look into a license agreement for your product, these commitments should become in a part of those future agreements also. Unless those future agreements carry this provision, you will never be able to keep up with the commitment. So we have to be very careful on that front. These are areas where, I want to just touch upon the Bayh-Dole Act or the compulsory licensing or margin rights, which has come up in a big way, because the government sees that once I have funded the project and I have funded the research, the development or the results of the research should also belong to the government. So there has to be some sort of a margin rights where I see that the funded academia or industry is not commercially commercializing the results of the project, or I at least have a royalty-free right in the patents so that I can do it for public interest in my own country at least. So US has got this Bayh-Dole Act, under which it has both the components, royalty-free right as well as margin rights in the patents of the funded NIH mainly. And we also in our country in 2008, we took up a bill which said that the protection and utilization of public funding will be governed by the Indian government. So that bill has not seen the light of the day. It is still with the standing committee of the parliament, which is actually discussing it again and again, how to take care of Indian scenario, how to adopt it in a given set of criminal and civil rights, what are already existing law of the land. So when you look at these margin rights and compulsory rights, even though it is by government, it can be done only in certain circumstances like public interest, when there is a breach of law, when there has to be a price control to make the thing affordable for the public, maybe an anti-cancer drug or a rare disease drug, or insufficient working of IP, which denotes that the industry having the patent has not commercialized it for India, for Indian market. And the dependent IP means there is an Indian IP which is available for Indian market, but without this IP, which is going to be the platform IP, there cannot be commercialization. So all these scenarios with adequate sort of an individual merits of the case, the government can look for a non-exclusive, limited scope, limited duration, non-assignable margin rights or compulsory licensing. So compulsory licensing also means the payment will be done by the licensee to the licensor as it is done in a normal scenario. We have 3 cases. Only one has been given under compulsory licensing, Bayer's Nexavar to Narco Pharma, and both rejections in our country itself after the first grant were for Spirizel as well as saxagliptin. So you see that it is very sparingly used. Compulsory licensing is a provision which is very sparingly used, but beware that if you license out the product doesn't mean these cannot kick in. Even if you license, the licensee will be amenable for the government laws, and therefore this margin rights or compulsory licensing will become applicable on them also. We are also a system where all these innovators can go and have their own startups, whether it is an incubator setup or an accelerator setup. AIMS has got its own incubator setup. You have accelerators with other institutes, government institutes. So if you look at the meaning of incubator and accelerator, I just probably almost slide.
Banu, can you sum up, please?
To give this sort of an idea to you, because these are all the terms you will hear from funding organization, where you have to be an incubator or you have to become part of accelerator to get fund. So beware of all these terms where you have an idea and you can actually grow along with the setup, which is based on common facilities and amenities.
Dr. Banu, can you sum up, please?
Yeah, this is the last slide. Yes, Dr. Rajesh, I'm going to finish it, and because we want to be US $100 billion industry by 2025, our pharma and biotech, we have to be very serious in taking our innovations, forward and commercializing them. Thank you. I know I took a little bit of time, but I don't get much opportunity to discuss with scientists. I think this sharing of information will be good for each one of you. Thank you very much.
Thank you, Dr. Banu. Actually, it was really very nice and comprehensive, and of course, there are things that many of us don't understand also as clinicians. So definitely guidance from experts like you is very essential. And I would like to have the opinion of the panelists. We have many esteemed panelists that, we clinicians, we like many things that Dr. Banu was telling, we clinicians don't, pay attention to these things or perhaps don't understand these things. So what's your opinion? And I mean, how can industry partnering help in these, and what all should be done? Maybe industry can help us in this.
So when can you tell your experience?
Yeah, thanks Namrata and Rajesh. I've been through some of these talks earlier, addressing our own colleagues. Wonderful talks by Dr. Tirumurthy, Dr. Chitra, and Dr. Banushree. Just a basic question which remains with most of our colleagues is, should we patent or not? Because all on the panel will agree that it's expensive. It is expensive. Indian patent may not be very expensive, but filing a PCT and thereafter entering the national phase is very expensive. So that, if you would allow me, Namrata and Rajesh, I can share a few slides if that's okay with you. Because is that okay with you?
Yeah.
Yeah, okay, fine. Because that makes things a little clearer for people, if I am allowed. Yeah. Yeah. Are my slides visible? Is my slide visible?
Yeah.
Yeah. So, I mean, this is from another talk. I just think shifted a few slides. So the basic question that comes is, what do you do next? Just for the record, I've been a big grantee in 2014 and IIGP 2016 winners, and I do have a financial interest in Medinmed Devices, which markets the BX People Expander. So now, whether we should invent, patent, or commercialize. So just briefly going through, these are the countries in which we hold patents. I mean, we've assigned all the patents to, I'm the inventor, and patents have been assigned to Medinmed Devices. And these are the countries where we hold our trademarks. So starting there, now should you patent? Because it costs a lot of money. I think the first question we need to ask ourselves as clinicians or scientists is our great idea viable in the marketplace? That's the first question. So the best invention in patent is one that can be commercialized, irrespective of whether you get the patent or not. So the money that you put in or the efforts that you put in are kind of, they get back their returns to some extent. So when we say what kind of great idea, and that's where I think it's very important, what is patentable? So discovery of an existing structure is not an invention. A technique is not patentable in India. Yes, it's in USA. But a new application of an existing device is not, again, an invention. Dr. Banushree and Dr. Chitra really touched upon certain aspects. So a new device designed with utility. Now, a variation without any novelty or inventive step, it's best to go ahead and publish because it's not going to be patentable. Incremental advantages, well, if you have a de novo novelty and inventive step, definitely you can patent it. And if it's a variation, like we talked about, Dr. I think Banushree talked about incremental steps, and you must consider, even if it's an incremental step, like the BX People Expander, it is an incremental step, but it's a huge incremental step, which made a difference. We brought the entire device into a single plane. And that was a huge difference and a huge novelty step. Though we had a lot of resistance in the national phase in every country, but I won all this thing. Let's forget this. So now we come down to the brass tacks. Now, if you have a great idea and you don't want to spend much time, effort, and money, you don't want financial gains or you want financial, let's decide that right at the outset. If you don't want financial gains, publish as early as possible, get credit. If you want financial gains, let's discuss with the industry. Now, if you're going to discuss with the industry right at the outset, without filing even a provisional patent, you may get a raw deal with no credit, and your idea is very likely going to be stolen, because the most often the industry comes back with you after you send them a mail and all your details. They'll come back to you within 3 to 4 weeks and say, "Oh, we had it in our pipeline. You see, we have already filed." I can see Dr. Banushree smiling because that's the usual. They'll come back and say, "It was in our pipeline. You see," and you will see a provisional patent being filed just within a week after you send them the email. If you want to bring it to fruition and succeed, irrespective of financial gains, and then you have a limited will to spend time, effort, and money, secure an idea, file a patent, and let me see, I can't move this, yeah. And then if you can spend time, effort, but not money, file a patent, prove your concept. If you're willing to do whatever it takes to bring it to fruition, well, there are other things. So if you have limited will, pitch to the industry, anyone who may have interest. If you can spend time, effort, and not money, apply for a grant, pitch to investors. If you're willing to do whatever it takes, then you have to be an inventor and an entrepreneur. You have to be bitten by the bug. You have to be crazy, someone like me. Government grants, I think we have a very qualified person over here, Dr. Banushree, who's from BIRAC. And so when we write a grant funding application, I think the most important thing is make every word of the application count. It's a very simple equation. 50 lakhs grant, 500 words. Each word is worth $1,000, $10,000. So when you write the grant application, that's what it should boil down to. And concept financing is over. So it has to have more proof. And we have DST, DBT, National Innovation Foundation, India, IIGP, TBI. We have technology-based business incubators. So once you have crossed the provisional patent stage, you can go on to all this. That would be my idea. So you should know what you want to do with your great idea. And because it's going to cost money, and how far you're going to take it is also something which we need to consider. Thank you for your time.
I think you rightly said there are two things to it. Now, for instance, Dr. Vel Pandian, the things that we have patented from, from a government organization, that's not going to, even if it becomes commercial, that's not going to directly benefit us. So what do you think, in terms of finances, for that matter? So why would you want to, patent so many things, and why would not all patents translate into commercial, viability and commercial ventures and commercial gains?
Let me answer this question, Dr. Namta. Sometime back, ICMR came up with a comprehensive, once Professor Balram took over as a PG. He came out with the plan of making, allowing us to get into startup. So now the scenario is changing right now. The scenario is changing. So the patent of ours so far, whatever we have done, which is lying with some other government agency, is going to do that. Definitely we'll get the credit for it, and also financial credit for it. But more is coming up to get partnership with the industry, or to start our own industry, or to get an incubator, placed in an incubator to go with that. Dr. Suvan was doing it absolutely. I think now you are allowed to do that. We are just waiting for that to be implemented at any moment of time. Then we will be able to do it. We'll be able to make it up.
Namrata, can I just intervene over here? Namrata, actually, it's not true that the scientists will not gain from it. It's only that in our medical field, the institutions are not geared that way. If you look at the IITs, they have the IP, the inventor has a share in the IP gains. So even if a 5% or a 2%, that whenever it's commercialized, that gains will go to the inventor. So it's a kind of co-sharing of the ownership. So the institute owns, the government gains, and the inventor also has a role. Yes, but that's part of the deal. When you join the institution, the employer or the institution head has a deal in place where IPR returns will be shared in a given ratio.
So as of now, it is not. Yes, sir.
So Dr. Namta, the point that you are making is not every company or any concept becomes a unicorn or becomes something great. There are more failures than successes, but that should not deter us from having a patent. It may be insignificant at a time that you think it is insignificant. For example, somebody had thought maybe 10 years ago that now what has been released yesterday was from Facebook, that the Wayfarer will have a camera in them and you can just digitally talk and the pictures can be taken from there. So the computer is actually moving on, and you can ask the Facebook to do things for you and see videos, etc., etc. So that things have moved on to your spectacles or your sunglasses. So even if you had, say, patented this at that particular time, and you may not have got it into fruition into a commercial thing, what Suven has broken down is that if you have an entrepreneurial mindset and a bug in you that you want to commercialize it, then you can look for grants. You can have the incubator stage, people who are incubating your ideas. You can have, as was rightly said, the accelerators thereon, but you will still command a percentage of that IPR and you will be sharing it with somebody else. And if you really don't want to do anything, you can actually sell your IPR to somebody else without actually working on it. So even your patent is saleable to somebody else. You transfer your trademark, you transfer your patent or anything to anybody. So there is no harm in actually patenting it. But the problem is that we have a great lawyer sitting with us. The lawyers command so much of money and they make the thing so complicated. There are times you really don't understand that jargon, but then you have to have a good lawyer, because that is the call of the day. Because even for small little things, even if we are getting a trademark for anything, there is somebody who's willing to oppose it. And they would then challenge you, and then ultimately they will even settle, you give me this much of money, I will withdraw my my objection, etc. It doesn't make any sense. For example, I'll give you, I filed for a trademark for CFS Vision. And who has opposed it? Borosil Vision. What has Borosil got to do with it? Borosil are makers of brass beakers and all those things, but they call that as Borosil Vision. So even the name of CFS Vision has been opposed by Borosil Vision. Obviously, we are fighting it out and we are sure to win it. But the point is that you never know as to who is going to oppose. So these lawyers are really something very, very essential that you have. And filing for trademarks and patents is something very, very important. I don't think that we should be guided only by whether it is commercially viable today. It could be the biggest hit tomorrow, because the idea is worth the billions that it is worth, and you may have to find somebody else and rely on somebody else to actually take it to fruition into a commercial concept. You can continue doing your scientific work. For example, let me just give you an example of this guy. I think Dr. Patel was with Alcon. So he made that material for Acrisoft lens, and he's still getting, though it is getting glistening, etc. They have changed the material, but he's still getting, I think, $1 per every lens, or some amount he's getting for every lens that is manufactured using that material. He's not the person who has made it into the fruition. He's the person who worked on the biomaterials, and he got that patented in his name. So that is where it is that you can keep to get the royalty, even if somebody is using that idea and making that commercially viable. So I would say that getting the mindset is something very, very important. And this symposium or additional symposiums that we do have to inculcate the concept of one's intellectual property right within ophthalmologists. That is something very, very important. And that is what I think should be the mool mantra or the take-home message at the end of this.
If I may, add to this, yes, patenting outside India is very costly, but there are several procedures to reduce the official fee. Okay, so if you are a startup entity, if you have less than 500 people, okay, if you have an Indian incubator, if you have a tie-up, if you have only one number of patents, or you carefully decide the jurisdictions, if you have partners, there are n number of ways to actually reduce the cost by several factors. If you are an individual and, till you don't get a license, you can still hold the patent in your individual name. And only when you license it, you can pay the differential fee. Okay, so a patent outside India is costlier than in India, but it is not so costly that, you have to be deterred by it. It is still possible to get it by, trying to find out all particular means to reduce the official fee.
Dr. Abhijit Kake wanted to say something. Yes.
Yeah, ma'am. I'd like to share my experiences and my learning in my journey. My thinking, or what I believe is, every idea that has a potential to patent. Now, ideas can be in processes, techniques, drugs, devices. Now that the idea, for patenting, it has to follow 3 rules: novelty, innovative step, and industrial application. Now I'll once these 3 criteria, if any idea satisfies, it can be patented. Now I'll add 2 more conditions, and to refine the process of or the process to know whether it's a patent, whether we should publish it or patent it. Now you just add it whether it's a significant unmet need. Now, significant unmet need, it has temporal as well as regional variations. Like Mahipal Sachdeva sir said, the patent may not have a value at this point of time, but in future it may have a value. So that is temporal variation of unmet need can happen. Second thing, there can be regional variations. Like there is an innovation by Dr. Khargi from KLE of water purifier. It's a very simple device. The rupees 32 he made it, and which may not be used in city areas, but in rural areas where potable water is a problem, or in poor developing countries, African countries, it may be a boon. So it may that idea may have a business potential in a different region, or it may be addressing a unmet need in a different region. So when if any idea is able to satisfy an unmet need in a particular region, or if you project that if you have a gut, or if you have belief that it may have in future some application, then you should think of the next step, that is whether it is viable. That means whether you should go ahead and develop it, and the next process, and if it is viable, whether it has a business potential. Now finally, all innovations, viability is you have to put in money to sustain patents and do prototypings and do there are a lot of paperwork, agreements, service contracts and all. So everything requires a lot of money. So whether that is viable, if it is viable, and then you look at it whether it has a business potential. Now if it is not viable, then I don't think we should spend in money and go ahead with patenting. Just publish it, get the credit of it, and that's it. If it has a business potential, if it has a potential to make money, then I think you should go ahead and then take your path to patenting. This is what I learned in my up till now in my process. The second thing, what I Sachdeva sir said about the mindset. Now, there are different opportunities, or there are different platforms. Like in Maharashtra, even in Pune, there are a venture center comes up with a hackathon called Medic, which gives you an idea of the whole, gives a very, in a nutshell, a small idea of how the innovation process goes. Similarly, IITB, even in collaboration with BIRAC and all, they come up with MEDA. MEDA is also one good platform to know whether, to get an idea of this thing. Now, coming back to Mahipal Sachdeva sir's point, whether I have that mindset. Now, up till now, what I've seen, there are two types of, there are two ways. There are some people who have passion in it, and there are some people who are actually enthusiastic about it. Now, people who are passionate into it, they'll be just thinking, they're really passionate about it. The whole time they'll be thinking about it, and the ideas or the characteristics which you can identify these people's is, these people will be very observant. They will have a very keen observation, and they'll be always thinking how I can improve this process, or how I can make any device better or any technique better. That is always going in their mind, and then they are working on that. So those are really passionate people. They are on auto mode, and these are generally serial innovators. The second are enthusiastics. They get an idea. See, while working with patients, while working on devices, everybody comes up with an idea. You feel this will help, and you want to make a change. So enthusiastic, that is a problem-based approach. Like, even if when we look at all these biodesign programs, like Stanford Biodesign, or AIMS itself has with Stanford a biodesign program. So the first stage is immersion. They'll be exposing the candidates to all the medical scenarios, and they'll be trying to find out all the what all problems they feel the clinicians are facing, or the scenario needs to be addressed. So that is immersion. So this is problem-based approach. So generally, enthusiastic will choose a problem, and they'll try to find solutions. So this is also one way of doing it. So this is for what to develop that mindset. What I feel is to develop that mindset, what you need is to develop a very keen sense of observation. Simple processes, you can make significant changes. And second thing, what you need is, you should always develop that mindset, how to keep on thinking, and how to develop that mind, how I can make those things better. So these 2 points, if a student can inculcate, I think it will be helpful, and it will come up with more and more innovators who can come.
Thank you,
ma'am. Thank you for the opportunity.
Thank you. Anybody would want to say anything? Nayak sir is there.
Just to add to what has already been said. Now, though
just one second, we can just ask sir to say whatever his thoughts are, and then we can come back to you. Okay, sir. Dr. Nayak sir.
Yeah. Thank you. Actually, it was a good program, but also, as just now Dr. Abhijit, whatever he pointed out, that was really more applicable for the common man, because so that if I'm sure everyone will have some ideas, and very nicely he even classified also that there are some who are passionate and there are others who are really enthusiastic about it. So that is absolutely true. So my suggestion would be that definitely if someone is working in a big institution, then of course you have institutional backup and you can take advantage of that institutional backup and facilities as well. But for small practitioners and small places, if you have something like this, then I will prefer that because it was so complex. Now, after listening to the first three speakers, and especially the Dr. Bhanusri, that it is so much problematic and so much that anyone who will have some idea, it will be a deterrent. That about the expenditure part, which were discussed, and the second about the procedure, it was so complex, which was described. But of course, the fact of the matter is that that is the reality. So we have to face it. So better thing that in case if someone has idea and someone has something to pursue and to follow it up in long run, then better to take advice from those, especially the ophthalmologists who have taken, and of course take advice from the experts and the lawyers as well, but also take advice from those who have got patented and they are really in this business, for business in the sense that in the field for some time, like Sugan Bhattacharya is really, he is known for his innovations and whatever Dr. Abhijit said. So like that, there are many who can give some guideline to that. But because if everything we want to assimilate, it's very difficult. We can't assimilate the entire law because it's a separate science and separate study altogether. So those things better to means we should not become masters of everything, cannot become, but at least whenever required, we should know when to take help and where to go for help. Thank you.
I guess maybe partnering with industry may help in.
Hello.
Dr.
Can I speak?
Yeah.
Hello, Dr. Dolakia here.
Yeah. Yes, Dr.
So, yeah, I have filed 2 patents. One patent I filed my own. So to file a patent is not a really very big job. It's just for provisional patent, it costs just you 1,600 rupees, ma'am. 1,600 rupees. So it's not a very costly affair. One thing. Second thing, you need to know lots of laws and all these things. So everything is there on YouTube. You study the YouTube videos, how to file patent and what are the provisional patent, what are permanent patent and everything. You need to learn all these things only once. Like medical science, like ophthalmic science, we learned once only. Then we are expert on this subject. So I filed one patent my own. It is a provisional patent, and then I handed over this patent to make it, permanent patent to the lawyer. And lawyer did some changes on my own writings, not very big changes. So to file a patent after hearing these advocates, and it may be frustrating to, as Dr. Nayak said, it is frustrating and it is very difficult. No, in my own experience, if we are doctor at this stage, we can learn so many other things also. It will take hardly 1 or 2 months to learn all these things. And another thing, I filed another patent with the help of another company, Madhu Industries. So we did a contract with a mutual contract, and I being an inventor and they become the owner of the patent. So we take the help of the company with. That is also not very difficult. So take home message from my side is that whatever new idea comes in your mind, if it can be done by your own, you just file a provisional patent. It will just cost you 1,600 rupees. Then you have 1 year time to study your own idea, to modify your own idea. If you want to take the help of the company, that is also with the help of your ideas. So it is not really very difficult according to my own experience.
Thank you so much.
That is my, yes.
So when you wanted
Thank
to
you.
say something,
Just to add to all that has been already said, and I did not want to intimidate.
If you have another point, please say. Huh?
Yes. Yeah. The cost is, official fees are always very low. It's the lawyer's legal fees is there, which is a fair amount. The question is, when do we bring them in? So all of us are postgraduates over here. We've done a thesis. So for filing a patent is very much like a thesis, like Dr. Dholakia said. So we should have our provisional application should be practically done by us, ready. And then probably if you consult the legal consultant, this is from an experience where actually I went up and got all my international patents on my own. But then on hindsight wisdom, I would say that it's best to bring in the legal expert after you have drafted your provisional patent, and then you get them to use certain technical terms which are going to be very relevant going down the line. And then, of course, you have 1 full year to file your complete specifications and do your PCT and other things. So you must bring in your legal consultant fairly early because you could lose certain very valuable points which you would like to have filed, and you'll miss out on a big opportunity.
Thank you. Thank you, Subin. I think those were great points. Dr. Parikumar would want to say something, sir.
I have a few things. Since being an ophthalmologist, I want all the ophthalmic patents to be owned by ophthalmologists. And AAOS being a big body of 23,000 people, it's not that difficult to compile the ophthalmic patents together and form a separate body from AAOS and make it easy and comfortable for people to submit their inventions and make it commercialize and all that. It's possible as a body, as AAOS it is possible. Because as Professor Naik said, it's difficult for individuals. So when we have a body to handle this, it's it's not that difficult. So may I suggest that AAOS brings up a separate body to handle patents and inventions in ophthalmology so that ophthalmologists can own ophthalmic inventions. That's my point.
Thank you so much. I think surely Dr. Naik sir is going to look into it. Then we have Dr. Gaurav Gupta. Would you want to give in your Gaurav?
Yes, ma'am. I think everyone has done most of the things, but I just want to add one point that as we are talking about the cost of the patent involved and should be patent or not, I would say everyone should patent, and initially we can get an Indian patent, which is not very costly. And once we realize that it is commercially viable, or we have some tie-ups, or we have that cost with us, then we can move to US or European patent. So first we should protect our right with the Indian patent, and then we can move further if the cost is a factor for us. So we should not be remain due to the cost that it will be very costly, as sir highlighted very well, Dr. Dholakia, that for Indian patent it is not very costly. So we can have an Indian patent first, and then we can move for US or European.
Subina wants to say something. Dr. Subina?
Yeah, Dr. Namrata, thank you. It's a lovely session. But I wanted to ask something like nowadays it is the concept of make in India, right? So if we have something which is made in US and with some modification we make it in India, so does it qualify for being a patent? Like plaques which they make eye physics, they are no longer dealing with India. So we make our own plaques. So will that qualify for a patent?
No,
No.
Oh, sorry.
It can. It can. It depends upon what the change is. Okay. And if the change has an effect and the change is not thought by a person skilled in the art, it is possible to get a patent. In fact, now Europe is granting patents for difference in population. Say, for example, in India, we have Asian population, and in Europe, we have a Caucasian population. Even the difference in drug treatment between Asian and Caucasians, Europe is granting patents. So it is not possible to give an overall blanket answer for this. The difference would be whether, what is the change and whether the change is inventive. That is the question to be asked. If the change is inventive, it can be done. This is incremental invention, and 97% of the patents across the globe are only for incremental inventions. That is why I request you do not be the determinant of whether it has to be a patent or not. Please ask a professional whether it has to be patentable or non-patentable.
Dr. Abhijit.
Thank you.
Yeah, madam, just to add to madam's point, Dr. Chitra, madam's point, ma'am, in the patents criteria, there is also one word, it should be non-obvious. So any incremental change or any new development which you are making, it should not be very obvious thing. If it is not obvious, then you can go ahead and patent the small change also. So I'm right, no?
See, what
the
is
second,
yeah.
one more thing, after the patent, after you have decided to publish a patent, when you have divided it and you wanted to patent it, my personal opinion is it is always better to go and consult with a patent attorney, because once you file the steps are very it's basically a law which we don't have much knowledge into, and it's a very deep topic. Once you file a provisional, there is something called, like we do in literature search, there is prior art search. You need to know whether anybody else has come up with a similar complaint, any of your claims is overlapping in anybody else's patent and all. So that prior art search, there are different databases in different areas that you have to prior art search, and then the drafting is so precise. It's basically a legal document. So even small commas, change in commas, and some small additions of some words and or can make a different context of that line, and it can also affect a patent. And there are cases in which people have lost, lost in courts when they're fighting for their patents. So my personal opinion is it's a purely legal language, which scientific matter put in a legal language. That is what the patent attorney will do for you. And finally, when you are dealing in patents, dealing with your or in courts or in all your transactions or your deals, it's a legal language, because it's the legal language which is considered. So all patents, everybody should, my opinion is you should go through only a patent attorney. Second thing is, it's not just writing a patent and that's it. If you have to enter PCT, if you enter PCT, then there is a national, if you after PCT, you will be entering national phases, you will be making business collaborations with different companies, and your suppliers are different. There will be NDAs. First step is NDA.
So I think Dr. Abhijit, the moral of the story is you can't go without the lawyer.
No, you have to have a lawyer. And it's not only a single lawyer, it's a team of lawyers. You have to have not only a single lawyer, you may require a corporate lawyer also along with him.
I just have one question for Suvain. Actually, Suvain, when you did the patenting, so in India you did it yourself, but for international patent you got support from industry, right?
Good question, Rajesh. Yes, like I said, hindsight wisdom is a lot. Without any disrespect to the legal experts over here, yes, I did my patent filing in India, PCT, and even all the prosecution and answering to the examiners was on my own. The legal experts mostly just filed it and filed the work. So it was a tough ride. That's because I did not have a very good, the first patent lawyer that I met wasn't very helpful, I would say. But that does not kind of certify the quality of other lawyers. You can do it, but the question is, you are putting yourself at a huge risk. That's what my hindsight wisdom says. Dr. Chitra said very perfectly that you should not be the determinant of what is your whether your invention is patentable or not. Leave that to the legal expert. With again due respect to Dr. Abhijit, what is obvious and non-obvious is the examiner's domain. How we are going to argue is going to be an entirely different ballgame, because how your claims are framed and how are you going to utilize those claims, or whatever you put into your provisional and in your complete specs is going to determine that. So obvious and non-obvious is the examiner's domain. So what is obvious in one jurisdiction will not be obvious in another jurisdiction. So you will have to fight it out. If you're convinced, you can fight it out. And it can take multiple rounds. My US patent went in about, I think, I think must have been one of the longest it went in. And I paid through my nose, but then we won it. We got it. So it is a tough road, but and if you take a legal help early, you can actually phrase it pretty well.
Thank you. So now I would request Dr. Deepika Singhal, I think, would you want to say something? Because all of us, Bansuri must be thinking, you know, that ophthalmologists can also debate so much. Sail across.
Thank you.
Please go ahead. Nice to hear everyone.
Thank you so much. I was fortunate enough to be in touch with 2 incubation centers. So as our department won a Newgen grant, so when I discussed with them, they provided the support of design lab, and we could, after lots of iterative process, design and develop a forceps for iris claw with proper angle, hold and hint. That made my process easy. So my suggestions is you should have a very good team with you and look for support of your colleagues and be prepared for rejection. And it's you should have a very good patent lawyer with you. And last but not the least, patience. Because we have filed our patent in 2016 and it was awarded in 2021. So we should have patience and everything. It's a very good session indeed. Yeah, thank you so much.
Thank you, Dr. Deepika. Now the speakers, I think we'll come back to the speakers once again. So you would have seen that all of our panelists are extremely experienced, have worked out the way themselves, and that is why these practical tips were coming. So what would you want to say as the last, message, or what concluding remark would you want to give Dr. Velpandian?
Indeed, it's really interesting to see the panelists about their experiences, diverse experience from one corner to other corner. But I think the take-home message is that, yes, we have a lot of stories at AIIMS to hear that who has initiated themselves, gone inside. This could be a learning experience. I think in ophthalmology, even somebody who is an expert of cornea will still prefer a retina specialist to do a surgery for their father. So, you should not take many things on your hand to go ahead, okay, I'm going to do it. So I think we should take a professional help, as Dr. Abhijit says. So to avoid, a lot of legal complications later, and we should publish after filing in case if there is any innovation. And that is a way forward hereafter. I think we should inculcate this in our academic setup too. This is what I feel, sir.
So now I know why you do not allow a publication of Netasol before you patent it.
Yeah, exactly. Now we have got both the publications, so we are very happy.
Dr. Chitra, yes.
I would like to answer it a little differently. When Benjamin Franklin first demonstrated electricity to Queen Elizabeth asked, "What is the use of electricity?" To which Benjamin Franklin responded, "What is the use of a newborn baby?" We do not know what our baby is going to become tomorrow, but we still give it adequate care, love, and wait for it to grow. All our inventions are our babies. So give it time, give it hope, give it chance. We don't know what it will become.
Very, very well put in.
Wonderful.
Yeah. So Bansuri.
Yes, actually, I would love to say that, the scientist should never lose the tempo. What is the attitude, basic attitude to be scientist? Lawyers are there in their places. I accept that reading law is not going to make you a lawyer, that also. But even as a real scientist, I would like to see people not just getting employed, but actually applying their attitude in all walks of life. As rightly said, Sir C.V. Raman said that there is no domain expertise as a scientist. You have to be there everywhere. Everything you see everywhere, you have to find a problem and you have to see how it can be solved. So that is how innovations happen.
So thank you very much, Dr. Bansuri. I would request Dr. Nayak sir, our president, to give the final remarks before we close.
So finally, I will not take much time now. It's a very useful session, and all the speakers were really they have given a lot of ideas, and at least they have shown us that it's not as simple as otherwise we feel. So it is something where it needs some amount of more information, some amount of more involvement, and also consultation with the experts. Because I know basic thing we should know, but we cannot become expert to know the nitty-gritty of each and every aspect. So for that, we have to take help whenever required by the right person at the right place and the right time. But we should also be aware, like Dr. Mukesh Dholakia said, that we should also we just in the YouTube, yes, of course, YouTube and other things will give you some guideline and some idea, but that is not all. That is because what happens, we feel, oh, this is all that we have to know. There are many other things which sometimes can create problems. So it's always better to be educated yourself also, but whenever required, you must take the help of experts. So this is what I feel. And of course, someone said that lawyers' fees are really, it's a deterrent for, usually everyone thinks that a lawyer ke paas jayenge, oh, to loot lega. So this kind of feeling, means it's there. Means I don't know. We can't change the mindset and the perspective of the general public, but this is what it is. So we have to take advantage and we have to take advice whenever required. But it's a really fantastic session, and I personally learned a lot. And sometimes means it also gives me some incentive that I can also do something.
Absolutely, sir.
Now
If the president of AIOS is so motivated, I'm sure all the others will follow. That's a great statement to make, sir. Thank you so much, sir. Dr. Deepika, you wanted to say something? You raised your hand. Or okay, Rajesh, would you give vote of thanks?
Well, a big thanks to all the speakers, and I must tell you one thing, that this is such a complex topic that it's difficult to learn from just a few sessions. You have to keep working yourself to brush up yourself, and then again attend such sessions. And we have our patent master, Dr. Velpandian, sitting there up on 6th floor. So whenever needed, I can always go to him. But then this session was very useful, and I would like to thank all the speakers and all the panelists who shared their own opinion. Some very valid points by Dr. Chitra and Dr. Banusri, and then of course the own experience of all the panelists, that what problems they faced and what all should do, and some very encouraging remarks by everyone. So a big thanks to all the panelists, and a big thanks to you also, Madam, for organizing such a wonderful webinar. And thanks to Dr. Nayak sir for supporting all these useful webinars. Thank you.
We have to think and organize, because sir only comes to those which matter. Otherwise,
Yeah.
Thank you so much, sir.
Sir first thinks whether this webinar is worth attending.
Useful or not, yeah. So when it gets passed from there, we know that we are on the right track. Thank you so much, sir. Thank
so
you.
litmus test is when I attend the full webinar, it means it's really worth it. So of course, unfortunately, before that we cannot know. But at least some guesswork can definitely tell that what type of whether it's really I should attend or not.
Thank you so much.
Thank you very much, Namrata.
And thank you, Dr. Parikumar. We will surely take this forward. Although we may not be able to give that kind of a help, but we would still see whatever can be done. I'm sure sir will look into it. Thank you, everybody. Thank you to our sponsors and our audiovisual team and the backend team, Sharik, Anand, and everybody for these good, almost more than 3 hours now show. Thank you so much. It's going to be there on YouTube and Facebook, so that anybody and everybody who wants to see on how to obtain a patent in ophthalmology can refer to it. Thank you so much.
Thanks a lot, madam.